Good morning, folks. Gracia, Pierre-Pierre, sports and exercise medicine specialist, aka Black Stallion. Today we're going to talk about Sever's disease, which is heel pain in growing kids. The reason I'm talking about this topic today is because about a week ago, a mom reached out to me because of heel pain in her daughter after participating in sports. So we're going to go over the definition, symptoms, the causes, prevention, treatment, and recovery of Sever's disease. Sever's disease is an inflammation of the growth plate in the heel of growing children. What is a growth plate? A growth plate is a bone that has yet to use and where the usually a body part, a bone grows. It is the most common cause of heel pain in young athletes, and it is believed to be due to repetitive microtrauma from the pull of the Achilles tendon on the growth plate. What are the symptoms of Sever's disease? The most prominent symptom is heel pain that can be in one heel or in both, and aggravated by physical activity, usually running, jumping, walking. And as a sign of the condition, the patient can be seen limping. What are the causes of Sever's disease? So any sports which involves running, jumping can be a risk factor. Wearing poor footwear, having tight lower leg muscles, having tight Achilles tendon, sometimes the normal growth pattern where the bones grow faster than muscle and tendons. Sometimes in the context of beginning of the season or the start of a new sport, or people with flat feet. All these are risk factors to develop Sever's disease. How can you prevent Sever's disease? You prevent it by maintaining good flexibility through stretching exercises. By avoiding excessive running, jumping on hard surfaces, and by using good quality, well-fitting shoes with firm support and shock absorbent soles. How do you treat Sever's disease? So the doctor will perform a physical exam, will take the history. This is a clinical diagnosis, meaning that it doesn't require an x-ray to make the diagnosis. The doctor would recommend to reduce the activity that's causing the pain. It will tell you to use some ice at the end of participation. It would recommend to stretch hamstring, calves, Achilles tendon 15 to 20 minutes, couple of times a day. Sometimes they recommend orthotics or support on new shoes. It would recommend to avoid going barefoot, and also it can recommend NSAIDs or analgesics when the pain is getting out of control. How do we recover from Sever's disease? So Sever's disease is a self-recovering condition, meaning that it will go away, the pain will go away if you stop participating in the activity or once the bone is done growing. There is no long-term disability expected, and that condition or the pain usually subsides within 3 to 4 weeks. Here you have it. We just discussed Sever's disease. We went over the definition, the symptoms, the causes, prevention, treatment, and recovery. It was Gracia, Pierre-Pierre, sports and exercise medicine specialist, aka Black Stallion. If you have any questions, please address them to my YouTube channel, IG, or Facebook page at Black Stallion ND. Once on my YouTube, if you like what you see, turn on your notification, subscribe, and share it amongst your friends. And please, let's join forces with me and let's get that fitness going.